Hi, everyone. It's DocTalk. Here we are in December, and the Thanksgiving holiday has passed. I hope you had a great one, and I hope you're getting set up for a really good Christmas, New Year's combo to come. Midweek celebrations, so it always takes 2 full weeks out of commission in terms of normal activity. Be prepared for that. The news of the week is twofold. Number one, really cold, frigid weather, accumulating snow and ice. Piece of fire equipment landed on its side with the driver injured who hit black ice in the middle of the night. So let's talk winter stuff. And as usual, we're going to talk a little infectious disease because we are at the point where the usual respiratory bugs are beginning to spread. And the Thanksgiving holiday, if it hasn't come already, is usually the first time that we really begin to share the bugs across the nation. So a number of you are fighting with colds and related respiratory infections. So just a couple reminders. When you're in public, if you will please, if you're sick, mask up. If you're concerned about yourself getting sick from other people, mask up. I'm in Oklahoma City today at an IAFC conference on technology solutions, which is fabulous. Getting out here, probably 20% of the people on the plane of all ages and underlying health wearing masks, mostly to protect themselves. To protect you, it's an N95 mask. To protect others, it's a surgical mask. We are washing our hands regularly because that's the most important public health tip that we can give at this time of the year. And the third really important health tip is get your vaccinations. So now is the time, if you haven't done so already, to get 2 vaccines, the flu vaccine, which has been a good match for the flu that's come to North America, and your COVID vaccination, which is an update related to the variants that are spreading now. For those of you in the senior group or with pregnant women or young children, RSV vaccination is available. So all 3 vaccinations available in your local pharmacy, public health departments, within your occupational health departments for my fellow public safety members. And it's a really good time to get them. Coming into the season, then around the holidays, you'll be well protected from infections. Please don't forget how important it is washing your hands. All right, the timely topic right now as we get to winter weather is number one, dress appropriately, dress in layers, cover your head. Number two, and very importantly, if you get respiratory infections, if you'll muffle your face when you're outside, it helps to keep humidity and the protective systems in your respiratory tract moving and working effectively, keep bugs away. Outside, when it's dry air and it's cold, it really kind of paralyzes the protective mechanisms that you have in your nose and your mouth. And so if you muffle yourself when it's cold outside and you're around other people, it helps you protect your respiratory tract. Next thing, wearing gloves and other things to protect your hands. From a very short period of time, if I could show you my hands cracked and split open, which is typically what happens to me this time of the year. And I'm using intense moisturizers to try to be able to reduce that as much as possible. Number 3, it's getting slippery outside. Remember when you're walking on slick surfaces, the more that you pretend you're ice skating, the better off you are. Be careful about carrying heavy objects outside on slippery surfaces. If you do that, you risk that carrying something and you just begin to slide, that heavy object will pull you over. So I'm kind of referring to all of the patients that I have seen in the cold weather in the last week and the things that they did. It is really dangerous if you're carrying a little child and walking on a slippery surface. I want to remind you of that. If there's any way that little child can be walking beside you or sliding beside you as you kind of drag them along the slippery surface, it is not a good thing when a parent has a child in their arms and they slip on ice. there's a huge risk that the child gets a severe injury or that the adult breaks an extremity or busts their head trying to balance the child as they fall down. So with the little children, we watched some of the really smart people take their little kids and slide them along by the hands when they were on slippery surfaces. For you as adults, if you'll wear appropriate shoes for slippery surfaces, we watch a lot of the elderly people this weekend walk in the snow as opposed to walk on the icy sidewalk. What a great idea. And for our older members of the community that are at risk for things like falling on ice, going outside to take out the garbage or going outside to walk the dog is a really dangerous event. Please respect how slippery it can be outside, particularly for those night times after dark and with the long dark hours this time of the year. If you will, please try to do any of your activities going outside when it is still light and when you can reach a surface or hold on to something that will keep you from falling. Otherwise, something as simple as taking the garbage out, getting the newspaper, getting your mail, taking the dog for a walk can be very dangerous, and we don't want to see that happen. We have also the threat this time of the year, and always carbon monoxide. As you're cranking your furnaces up for the first time, they're not operating efficiently, or over the summer, fall months, one of the vents got obstructed by a bird's nest or something else. And as you're trying to begin to heat your home, you've got carbon monoxide floating in. The symptoms of carbon monoxide are headaches, nausea, and dizziness. Those are the three cardinal signs of carbon monoxide poisoning. Remember, carbon monoxide you can't smell, you can't taste, you can't see. And so that coming into your family's residence or your parents' residence or your neighbor's residence, because you take care of your neighbor when the weather's extreme, you want to look for those symptoms and make sure that if there's any danger, you get them out of that building. Always recommend, and a really good holiday gift for someone who doesn't have it, is a carbon monoxide meter. That detector you put up in their home, teach them how to use it or teach yourself how to use it and use that as a protective mechanism. In bigger homes, you need multiple of those and put in the places where there's most likely the carbon monoxide sources and where you sleep. It's really important that you get alarmed if the malfunction occurs and that CO is escaping into your house during the nighttime hours. So a little bit of timely news related to cold weather and the appearance of ice and snow across much of the country. I always will talk about driving safety, you know that's there, and then prepping for the holidays, because our next presentation will be about holiday safety as we move into that time of the year. We have lovely weather, and a lot of people really look forward to these cooler temperatures and being able to appreciate really beautiful blue skies, which is exactly what it is today in Oklahoma City. Enjoy this time of the year as best you can. Get set for the holidays. Thanks for listening to Doc Talk. Talk to you in a couple weeks. Thanks.